Celiac disease is often misunderstood as just another food allergy or a simple intolerance, but in reality, it is much more complex and serious than that. Unlike a typical food sensitivity, where someone might experience mild discomfort after eating certain foods, celiac disease is a lifelong autoimmune disorder that can have far-reaching effects on the body. It's not just about avoiding a certain ingredient, it's about managing a chronic health condition that requires constant vigilance and care. When someone with celiac disease consumes gluten, a protein found in wheat, barley, and rye, their immune system mistakenly identifies it as a threat. This triggers an immune response that doesn't just cause temporary discomfort, but actually attacks the lining of the small intestine, leading to real, measurable damage. The small intestine is lined with tiny, finger-like projections called villi, which are essential for absorbing nutrients from food. In celiac disease, these villi become inflamed and flattened, making it difficult for the body to absorb vital nutrients like iron, calcium, and vitamins. Over time, this damage can become severe, leading to a wide range of health problems that go far beyond the digestive system. People with celiac disease may experience symptoms such as chronic diarrhea, persistent fatigue, unexplained weight loss, anemia, bone pain, and even neurological issues like headaches or numbness. In children, it can cause delayed growth and development, irritability, and failure to thrive. The symptoms can vary widely from person to person, making diagnosis challenging. The only effective treatment for celiac disease is a strict, lifelong gluten-free diet. This means carefully reading food labels, avoiding cross-contamination, and making significant lifestyle adjustments. Even small amounts of gluten can trigger symptoms and cause intestinal damage, so vigilance is essential. Unlike non-celiac gluten sensitivity, which does not cause lasting harm to the body, celiac disease results in measurable immune damage that can be detected through blood tests and biopsies. This distinction is important, as the long-term health risks associated with untreated celiac disease are significant. If left untreated, celiac disease can lead to serious complications, including the development of other autoimmune disorders, osteoporosis due to poor calcium absorption, infertility, neurological conditions, and even certain types of cancer, such as lymphoma of the small intestine. Despite affecting millions of people worldwide, celiac disease is still frequently underdiagnosed or misdiagnosed. Many individuals may suffer for years with unexplained symptoms before finally receiving an accurate diagnosis, which can be both frustrating and isolating. Raising awareness about celiac disease as a complex autoimmune disorder, not just a food sensitivity, is crucial. With better understanding, we can improve early detection, provide stronger support for those affected, and help ensure that people with celiac disease can lead healthier, fuller lives. Celiac disease requires a specific genetic predisposition, mainly the HLA-DQ2 or HLA-DQ8 genes. About 30 to 40% of people have these genes, but only 1% develop the disease. These genes create immune cell receptors that can mistakenly identify gluten as a threat. Genetics alone isn't enough. Environmental triggers are also needed. Celiac disease often runs in families, so relatives of patients are at higher risk. Screening family members is standard practice. Understanding your genetic risk is important, but it's the interaction with environmental factors that determines who gets sick. The genetic loaded gun needs an environmental trigger to fire. Gluten is the environmental trigger that sets off a complex chain reaction in the body, but only for certain people. This protein, found in everyday foods like bread, pasta, and baked goods, is a staple in many diets around the world. For most, gluten is simply another ingredient, something to be enjoyed without a second thought. But for others, it's the spark that ignites a lifelong health challenge. In genetically susceptible individuals, eating gluten can activate celiac disease, an autoimmune disorder that affects millions globally. This means that a simple family meal, a sandwich at lunch, or a slice of pizza can trigger a cascade of symptoms and internal damage for those at risk. Gluten proteins are found in wheat, barley, and rye. While these grains are harmless and nutritious for most people, they pose a hidden danger for a select group. The problem isn't the grains themselves, but how the body reacts to them in people with certain genetic markers. Specifically, those who carry the HLA-DQ2 or DQ8 genes are at risk. These genes are common, about 30 to 40% of people have them, but only a small fraction will ever develop celiac disease. The presence of these genes is necessary, but not enough on its own. In people with these genes, gluten fragments resist normal digestion. Instead of being broken down and absorbed harmlessly, they linger in the gut, where they can cause trouble. These undigested fragments cross the gut lining, slipping through the protective barrier of the intestine. Once inside, they trigger the immune system to attack the body's own tissues, mistaking them for dangerous invaders. This immune attack damages the villi, tiny finger-like projections that line the small intestine and help absorb nutrients. When the villi are flattened or destroyed, the body can't absorb vitamins, minerals, and other nutrients properly, leading to malnutrition and a wide range of health problems, from digestive discomfort to fatigue, anemia, and even growth issues in children. Every time someone with celiac disease eats gluten, the cycle of inflammation and damage begins again. Even tiny amounts eaten repeatedly over time can keep the immune system on high alert and prevent healing. The only proven way to stop this autoimmune process is to remove gluten from the diet completely. This means reading labels carefully, choosing gluten-free alternatives, and sometimes making difficult choices in social situations. But with strict avoidance, the gut can heal, and symptoms can improve or even disappear. Interestingly, millions of people have both the genetic risk and eat gluten regularly, yet never develop celiac disease. This suggests that gluten and genes alone aren't the whole story. Scientists believe there must be a missing third factor, an additional environmental trigger that tips the balance and starts the disease process. This could be anything from a viral infection to changes in gut bacteria or even stress. The search for this elusive trigger is ongoing. Understanding what sets off celiac disease in some, but not others, is crucial for developing better ways to prevent, diagnose, and treat this challenging condition. Genetics and gluten aren't enough to explain why celiac disease can appear suddenly after years of tolerance. Research points to viral infections as the third trigger. Certain viruses, especially those infecting the gut, can provoke intense immune responses. In genetically susceptible people, this inflammation can cause the immune system to mistake gluten for a threat. Once gluten is flagged as dangerous, the immune system attacks every time it's consumed. This explains the unpredictable timing of celiac onset. Genes, gluten, and a viral infection must converge. Understanding this perfect storm is shifting research toward prevention. When we think about celiac disease, gluten is usually the first culprit that comes to mind. But behind the scenes, certain viruses may be quietly setting the stage for this lifelong condition. Enteroviruses and reoviruses are now recognized as leading viral suspects in triggering celiac disease, acting as unwelcome guests in the gut that can disrupt the immune system's delicate balance. Enteroviruses are especially common in childhood, often causing mild or even unnoticed infections. Yet, research shows that a single encounter with these viruses can increase a child's risk of developing celiac disease by as much as sixfold. This means that a routine childhood illness, which might seem harmless at the time, could have long-term consequences for gut health. These viruses don't just pass through the body unnoticed. They can inflame the lining of the gut, making it more vulnerable. When the gut is inflamed, gluten proteins are more likely to trigger an aggressive immune response, setting off the chain reaction that leads to celiac disease. Reoviruses, on the other hand, are usually considered harmless. But animal studies have revealed a surprising twist. These viruses can break the immune system's tolerance to gluten. In other words, after a reovirus infection, the body may start to see gluten as a threat, even if it never did before. Supporting this, people with celiac disease often have higher levels of antibodies to reoviruses in their blood. This suggests that past exposure to these viruses may have played a crucial role in the development of their condition, even if the infection itself went unnoticed. What's even more concerning is that these infections don't always cause obvious symptoms. Even silent, symptom-free infections can leave a lasting imprint on the immune system's memory, quietly increasing the risk of autoimmunity later in life. These findings highlight a crucial point. Common viruses, which most of us encounter at some point, can set the stage for lifelong autoimmune conditions like celiac disease. It's a reminder of how interconnected our environment, our immune system, and our long-term health truly are. So, the next time a child comes down with what seems like a minor infection, it's worth remembering that even these small events can have a profound impact, potentially triggering celiac disease in those who are genetically susceptible. The COVID-19 pandemic has shown how powerful viruses can trigger autoimmune diseases, including celiac. COVID-19 causes intense inflammation, increasing the risk of immune mistakes. Studies show people are up to 3 times more likely to develop autoimmune diseases after COVID-19. The inflammation can awaken dormant immune cells and damage tissues, exposing new targets like gluten. For those genetically at risk, COVID-19 could be the final push toward celiac disease. Vaccination reduces this risk by preventing severe infection and limiting inflammation. The pandemic has underscored the link between viral infections and autoimmunity, reinforcing the viral trigger theory. Timing of infection is critical, especially in early childhood. The window when babies lose maternal antibodies and start eating gluten is a period of immune vulnerability. If a gut virus strikes during this time, the immune system may misidentify gluten as a threat. This can set the stage for lifelong celiac disease. The timing explains why some children develop celiac after a routine illness. Protecting at-risk infants from certain viruses during this window could prevent the disease. Understanding this timing is key for future prevention strategies. Statistics reveal the real impact of viral triggers on celiac risk. Celiac disease affects up to 1% of people, but risk spikes after certain infections. Children with recent enterovirus infections are over 6 times more likely to develop celiac. COVID-19 infection triples the risk of new autoimmune diseases, including celiac. Even a 1% increase means millions more cases worldwide. These numbers show viral triggers are not just theory, they're a public health reality. Recognizing recent infections can help doctors diagnose celiac sooner. The data transforms the viral trigger theory into a measurable phenomenon. Discovering viral triggers for celiac disease opens the door to prevention. Vaccines targeting key viruses could stop celiac before it starts. If proven, vaccines against enteroviruses or reoviruses would be a public health priority. Protecting at-risk children during critical windows could eliminate the trigger. COVID-19 vaccines already show that preventing infection reduces autoimmune risk. This real-world example strengthens the case for vaccine research in celiac prevention. The future may hold a simple shot to prevent a lifelong disease. We're moving from managing celiac to imagining a world where it can be prevented.